Bismillahirrahmanirrahim. Today we have a case study on cardiology. We have a case related to cardiology. Uh, in this case study, a 64-year-old man has recently suffered from MI, and this patient is on aspirin, atorvastatin, and ramipril. Additionally, he has been trouble in sleeping and he has been losing his weight for past 4 months. He does not enjoy small things. He has also stopped socializing. What is the appropriate treatment for this patient? These signs represent and indicate that the patient is suffered from depression. So in this case, what would be the appropriate treatment of the following drugs? Number A, lofipramine, dusilipine, citalopram, fluoxetine. The answer is C, citalopram. This is a drug of choice in this condition. Let's come why the depression is occurred most of the time. The patients who are recovering from MI. There are so many factors, but we just discuss few of them. Depression is common. Depression is very common from the patients who are recovering from MI. Statistically, 1 out of 6 has suffered from MI. They often at least twice as many symptoms they experience after the event. Now I'm going to answer the question why. There is a poor compliance. It means the patient does not follow recommendations. It means he has some problems. He does not follow food restrictions. He does not use medicines in proper time and the assignated time. And there is also maybe the medication cost too high. There may be a lot of medicines that are used in a day, and there may be the problem of availability. When he uses medicine regularly, maybe he has a problem availability of the medicines. There are some social factors also contribute in the depression. So we will discuss the part 2 of the case study in the in the next lecture.